everyone. I am Lourdes Jane Hordista Renoblas, a Level 1 nursing student from the University of the Visayas. And in this video, I will be performing my written demonstration for preparing parenteral medications. Medication is a substance administered for the diagnosis, cure, treatment, relief of symptom, or the prevention of disease. Parenteral medications are given through a route other than the alimentary canal. The purpose and significance of preparing parenteral medication is to provide a medication the client requires. Perform hand hygiene. Next is to prepare the medication ampule for drug withdrawal. This is done to save time and effort and to carry out tasks in a systematic manner. Here I have a plastic ampule, assuming that this is a glass ampule. Next is to flick the stem of the ampule with the fingertips several times. This facilitates movement of medication from the stem down to the body of the ampule. Next is to place a gauze pad in between your thumbs onto the neck of the ampule. This prevents the nurse's hands from getting cuts from any shattered glass fragments in the attempt of breaking the ampule off. Next is to bend the neck of the ampule towards you to ensure that it is broken away from you. This prevents the nurse's face and hands from getting cuts from the shattered glass fragments. Next is to dispose the broken top of the ampule in the sharps container to prevent getting cut from the shattered glass. Next is to place the ampule on a flat surface since the solution dribbles out when the ampule is inverted. Next is to attach a filter needle to the syringe. The filter needle will prevent the glass particles from coming into contact with the medication. Next is to remove the needle cap and insert the needle at the center of the ampule. The use of a needle will prevent any small glass particles from being introduced to the medication or from being accidentally withdrawn. Next is to withdraw the prescribed amount of medication into the syringe. So I will withdraw 1 ml of medication as per doctor's order. This is done to abide by the 10 rights of medication in order to prevent medication errors or mistakes and to ensure that the right medication is given to the client. Next is to dispose of the filter needle in the sharps container. The safe use and disposal of sharps prevents injury and acquisition of blood-borne viruses for both the nurse and the patient. Next is to replace the needle with the original needle and tighten the cap at the hub. Perform hand hygiene. Next is to mix the solution by rotating the vial in between the palm of your hands, since much of the insulin may not be mixed together. Next is to remove the protective cap or clean the rubber cap of the previously used vial with an antiseptic swab. This is done to prevent contamination. Next is to attach a filter needle to the syringe. The filter needle will prevent glass fragments or glass particles from being introduced to the medication. Remove the needle cap and inject air equal to the amount of medication to be withdrawn. So later on, I will withdraw 1 ml of medication, so that means I will also be withdrawing 1 ml of air. So, injection of air is done to prevent the formulation or the formation of a partial air vacuum inside the syringe. If not enough air is injected, the negative pressure will make it much more difficult to withdraw the medication since the vial is a sealed container. Next is to carefully insert the needle at the center of the rubber cap. Next is to make sure that the bevel of the needle is above the surface of the fluid level and inject the air. The injected air will make it much more easier to withdraw the medication. So, next is to withdraw the prescribed medication as per doctor's order. You can either do this by A, holding the vial down with the bevel of the needle below fluid level. The vertical position makes it easier to remove air. Or B, to invert the needle, which I will be doing for this procedure, and keeping the bevel of the needle below the fluid level also, and gradually withdraw the medication. So, inverting the needle makes it impossible for air to be aspirated into the syringe.